Hello, my name's Gideon Hirschfield, and I'm a professor of liver medicine in Toronto. I direct the autoimmune and rare liver disease program, and because of that, I look after a lot of patients with primary sclerosing cholangitis. I also work closely with patient charities, including PSC partners seeking a cure. I think although PSC is a very difficult disease to have, it's also a time of great hope and optimism in the field. I don't think since I started looking after patients, there's been as much collective effort amongst patients, doctors, industry, regulators to make a difference for people living with PSC. I think there's more hope and resilience than ever. And on the horizon, I really do see the opportunity for new treatments. By working together, we've raised awareness of the disease. We've made sure that patients know how to signpost themselves to clinicians and clinical centers who are interested in looking after patients with PSC, and moreover, are committed to doing clinical trials. With clinical trials, we're learning more and more about the science of PSC and which drugs will benefit patients for the future. In the last year, there's been a number of phase 2 and phase 3 clinical trials, and in Europe, there's the spectre of potentially a new therapy for people living with PSC. That, alongside with basic science research led by physician scientists and basic clinical scientists from around the world, means we understand more and more about PSC, the biology, and the links with inflammatory bowel disease, which is clearly so closely linked to the disease itself. Therefore, I think it's a fair summary to say at the end of 2025 and then looking to 2026 that we really can be more optimistic about PSC. We know how to interact with our patients. We're much better at guiding them through this journey, which can have ups and downs. And on the horizon, I think there's real hope and optimism that not only will we care for patients, manage their symptoms better, but also we hope to develop drugs that will change the natural history of the disease and ultimately prevent liver transplantation. So on Global PSC Awareness Day and Week, I want all those patients of mine and all those other patients I've met with PSC to remain optimistic, to be resilient, and to remember that everyone is pulling in the same direction, seeking a cure for this difficult disease.